HIV, AIDS, and sexually transmitted infections known as STIs have spread throughout Bali, which has a population of 4.22 million in 2012. According to the Indonesian National AIDS Commission 2014 report, of Indonesia's 33 provinces, Bali has the fifth highest number of reported HIV cases, almost 10,000, and the fourth highest number of reported AIDS cases, over 4,000. In Bali, condom use and perceived susceptibility to HIV among men and sex workers is generally low. However, various data indicate substantial levels of STIs in the general population. Despite this, information about HIV, AIDS, and STIs is mainly targeted at high-risk groups and does not reach all segments of the population. Women suffer more severe consequences of STIs than men, including impaired fertility and health due to biological vulnerability to infection and the lack of early symptoms in many women.
Founded in 1999, Yayasan Rama Sesana are committed to improving women's health and empowering low-income women through education and the provision of health services. YRS are located in Bali's largest traditional market in Pasar Bedang, a location strategically chosen due to its high population with up to 3,000 vendors and thousands of workers and shoppers. Being situated in the heart of the market increases women's access to health information and education when time and money are of high priority. 70% of clients that engage in the services offered by YRS are from this market.
Hi, I'm Sinta and I work in two largest traditional markets in Bali as program manager for Yayasan Rama Sesana. Today we provide reproductive health services and empowerment to more than 7,000 poor women. We help them to make informed decisions about their health, and over the next 5 years we will expand our services to every traditional market in Bali to touch every poor woman who has contact with this market. Thank you.
YRS reach women in the marketplace through applying link worker methodology. Information is spread from woman to woman via word of mouth. Educational information about family planning, safe childbirth, sexual health, and violence against women are topics women can learn, which are the key to improving health outcomes for women and children in Bali. Women then share this information with close friends and family, creating a flow-on effect as the information circulates from a trusted source.
The overall goal of YRS is to improve community reproductive health and empower women from a low-income society in Bali. The following real-life story highlights the impact that YRS are making on individual lives in Bali today. Dewey is a young 28-year-old woman. She has always dreamed of having a baby. However, despite trying to conceive for the last 2 years, she had been unsuccessful. One day, in her curiosity, she joined a YRS discussion group. The topic was on women's reproductive health and was held during the International Women's Day celebrations. She sat in the corner and listened.
Initially, I just wanted to come and listen, but in the discussions, they were explained about pregnancy and the problem. It made me interested because I had that problem. I listened and took notes and asked about my problems and got a satisfactory answer. At the end of the session, I asked for some brochures to read at home, and I also informed my partner and some of my friends about Yayasan Rama Sesana and reproductive and sexual health issues.
A few days later, Dewey decided to come to the YRS clinic for an examination. She requested a pap smear and several other tests, as well as received a full consultation. She really wanted to have a baby. A few months later, Dewey came again to another YRS monthly discussion. At the end of the session, she came to one of the YRS staff and said,
I'm very happy and pregnant now. I'm almost 2 months. I want to say thank you to YRS. My problems are now solved, and I will have a baby soon. Thank you for giving me the information about reproductive health so that I could become aware of the problems and know where to find the answers. Just come to YRS and my problems are solved. Yayasan Rama Sesana have developed 3 unique programs to reach, educate, and provide healthcare services to the women of Bali. The traditional market clinic, education, and outreach programs, and mobile clinics.
Situated in the heart of the markets, the Market Clinic is an open and approachable clinic providing free services. Whilst donations are accepted, the purpose of the clinic is to reach and educate the women. From pap smears and prenatal care to general health checks, the clinic offers clients a range of services. YRS have been so successful in reaching women and families in the marketplace that they have initiated the same business model in other markets around Bali through mobile clinics.
The first YRS mobile clinic was established in Denpasar in 2013. The YRS run mobile clinics throughout Bali to reach thousands of Balinese women residing in rural and remote areas. These women have tremendously restricted access to sexual and reproductive health services. The services that YRS provide through their mobile clinic includes counseling, dissemination of educational materials, pap smear test, STI, and HIV and AIDS screening. They also do breast examination and general health checks. Every month, over 40 women attended educational sessions hosted by YRS. 10 to 15 peer educators assist with outreach programs developed by the YRS to meet their monthly targets. Program staff and peer educators distributed approximately 400 condoms and over 600 pamphlets and booklets per month to those interested free of charge. The staff at YRS have noticed an improvement in both knowledge and attitudes along with safer practices, including a willingness to discuss and use condoms with their partners.
YRS are impacting their local community with 43,700 people engaging in their services annually. In January, 25 UTS students, accompanied by Dr. Christine Catling, had the privilege of visiting YRS in Bali. The YRS staff welcomed our large group into their clinic, showing us their facilities and walking us through the markets whilst explaining what they do. Standing in the midst of the marketplace, bustling with trade, was a confronting and eye-opening experience. It was also a positive experience to see just how effective YRS are in reaching women by positioning themselves in the marketplace. It was a privilege to see firsthand the work of YRS. There is still a great need for family planning and education surrounding women's health in Bali and around the world today. YRS are providing the solutions needed and making a difference to women's health in Indonesia. Whilst YRS receive core funding from Inspirasia, the need for family planning and reproductive services remains high. Help make a difference today by making a donation.